The news of a brand new $3,000 stimulus package has now officially been signed into law, and this update is sending waves of relief and anticipation across the country. For months, there has been speculation, heated debate, and uncertainty over whether the government would step in with another round of direct support to help families and individuals navigate rising costs of living, medical bills, and everyday financial struggles. Now, with the president's signature, the deal is finalized, and the focus has shifted toward who qualifies, when payments will arrive, and what this means for the economy and communities everywhere. At the center of this legislation is a clear prioritization of households and seniors. Families with dependents will see a structured benefit aimed at providing both immediate cash relief and long-term stability. This means direct checks that are expected to reach eligible households in the coming weeks, followed by supplementary credits designed to support essential needs like food, housing, and childcare. Seniors, especially those living on fixed incomes such as Social Security, will also be among the first to receive direct disbursements, a recognition of the disproportionate impact inflation and healthcare expenses have had on older Americans. The emphasis on these groups highlights the government's intent to target those most vulnerable to financial instability. The $3,000 figure has generated widespread attention, and it's important to understand how it breaks down. While not every recipient will see the same amount in their accounts on day one, the framework ensures that qualifying households will have access to funds through a combination of immediate payments and structured installments. For example, many families with children may see an initial payment of $1,500 arrive quickly, with the remaining distributed in 2 additional waves. Seniors may be eligible for an upfront lump sum payment, depending on their income level and dependency status. This phased approach is designed to prevent delays while also ensuring smoother distribution across millions of households. For working-class families, this package is expected to provide a much-needed cushion against expenses that have been steadily rising for essentials like groceries, rent, and utilities. The legislation's text acknowledges the unique strain faced by middle-income households, many of whom have struggled to keep pace with inflation despite being employed full-time. In addition, there are specific provisions offering tax relief credits that could further extend the benefits for those balancing employment and caregiving responsibilities. For seniors, the direct payments will supplement existing programs like Medicare and Social Security, offering a lifeline for out-of-pocket medical costs and prescription needs. Lawmakers have positioned this package not just as emergency relief, but as a stabilizing force intended to provide breathing room in an economy where many feel squeezed. The reaction from the public has been immediate and intense. Across social media platforms, families are sharing stories of how the stimulus could help them cover backlogged rent, pay off medical bills, or simply stock their pantries with enough food for the month. Seniors advocacy groups have praised the package as overdue recognition of the financial struggles faced by retirees living on fixed benefits. Economists, however, are divided. Some argue that while the package will provide a short-term boost to consumer spending, it may also add fuel to inflationary pressures if not carefully balanced with broader economic policies. Others insist the targeted nature of this plan, directed toward families and seniors, makes it more efficient and less likely to overstimulate demand compared to previous blanket relief bills. From a political perspective, this legislation marks a significant moment. Lawmakers who champion the bill are already pointing to it as evidence of delivering tangible support to voters, especially ahead of upcoming election cycles. Critics, meanwhile, question the funding sources and long-term sustainability of such stimulus efforts. They argue that while direct checks may ease pain temporarily, systemic issues like healthcare costs, housing shortages, and wage stagnation require broader structural reforms. Still, the overwhelming focus for everyday people is not on partisan debate, but on the practical question: when will the money arrive, and how will it help me and my family? Distribution of the $3,000 stimulus is expected to follow a tiered timeline, with priority groups receiving funds first. Seniors enrolled in Social Security or Supplemental Security income programs will likely see automatic deposits within the first few weeks, since the government already has their direct deposit information. Families who filed tax returns in the past 2 years, particularly those who claim dependents, will also be fast-tracked. For others who may not have filed taxes recently or who operate outside the traditional banking system, the legislation includes directives to ensure prepaid debit cards and paper checks are made available to avoid leaving anyone behind. Officials stress that accessibility is a core principle, and efforts are being taken to streamline communication so people know exactly what steps they need to take to claim their benefits. Behind the scenes, the mechanics of funding such a sweeping initiative involve a mix of reallocated budget resources and newly authorized expenditures. Lawmakers have justified the package by pointing to the extraordinary circumstances facing millions of Americans, from inflationary spikes in essential goods to the lingering impacts of the pandemic on employment and housing security. The bill is framed as both a relief mechanism and an investment, one that could ultimately stimulate local economies as families spend their stimulus on groceries, childcare, healthcare services, and housing costs. This, in turn, is expected to provide a ripple effect, helping small businesses and service providers across communities. Public response has not only been emotional, but also cautious. Many recall prior stimulus packages where confusion over eligibility and distribution delays left households in limbo. This time, officials promise clearer guidelines and a more efficient rollout. Websites and hotlines are being set up to handle questions, and public information campaigns will target vulnerable populations to make sure seniors and low-income families don't miss their benefits. Advocacy groups are already preparing outreach programs to assist individuals with limited digital access, ensuring that the elderly and underserved communities have the support they need to navigate the application or claim process. The broader implications of this stimulus reach beyond personal finances. Economists are examining how this injection of direct payments could influence inflation trends, labor market participation, and overall consumer confidence. Some argue that the package could encourage greater economic stability by alleviating immediate household stress, thereby reducing reliance on credit cards or payday loans. Others warn that without accompanying reforms in housing affordability, healthcare access, and wage growth, the relief may only serve as a temporary patch. Regardless of the academic debates, the lived reality for families is clear. A direct payment of up to $3,000 could mean catching up on overdue bills, securing stable housing for another month, or covering critical medical expenses without falling deeper into debt. Politically, the passage of this package underscores the shifting priorities of government leaders in response to public demand. Recent surveys show that a majority of Americans, regardless of party affiliation, supported some form of direct relief in light of rising costs. By signing this package into law, leaders have effectively acknowledged that the financial strain many households face cannot be ignored. Critics remain vocal about long-term debt implications and the precedent of repeated direct payments, but for many constituents, the immediate relief outweighs abstract concerns over national deficits. The public's focus is firmly on survival and security, not macroeconomic debates. For seniors, in particular, this package is being hailed as recognition of their struggle. Advocacy organizations point out that retirees often cannot supplement their incomes through additional work, leaving them more vulnerable to inflation and unexpected medical bills. A $3,000 stimulus, arriving at a critical time, may provide breathing room for essentials like prescriptions, rent, and utilities. For families, the support translates into stability, help with school expenses, groceries, or childcare costs that continue to rise. The targeting of these groups illustrates a strategic approach. By supporting those most financially constrained, the package aims to create both humanitarian relief and practical economic stimulation. The story of this stimulus package is also one of timing. With household budgets stretched thin, many Americans are at a tipping point. Stories are emerging of parents skipping meals to feed their children, retirees rationing medication to make prescriptions last, and families falling behind on rent despite working multiple jobs. Against this backdrop, the passage of a $3,000 stimulus is not just a policy choice, but a message. The government is listening, and action is being taken. Whether one views it as a political maneuver, an economic intervention, or a moral imperative, the reality is that millions of households will soon feel its effects in tangible ways. Looking forward, the implementation of this package will serve as a test case for how the government handles large-scale direct relief in the modern era. If the rollout is smooth, efficient, and equitable, it may restore faith in public institutions' ability to respond to crisis. If plagued by delays, confusion, or inequities, it could deepen skepticism and fuel political division. For now, however, the spotlight is on the hope and relief that this law represents. Families and seniors across the nation are waiting, watching their mailboxes, checking their bank accounts, and anticipating the arrival of a payment that could change their immediate circumstances. The $3,000 stimulus package is not just a number on paper, it is food on the table, medicine in the cabinet, and stability in a moment of uncertainty.